Good evening. Today I'm going to be talking to you about the proper technique to take whenever you are splinting an extremity. So as you will see further in this video, my victim, she had an injury to her ankle, and I took the proper technique to take care of that. Now I don't think I really talked about everything that I wanted to talk about whenever I was actually treating my victim. So I'm going to talk to you about that now before we watch how I actually did it. So whenever you splint a injured ankle, you're going to follow the RICE procedure, and RICE stands for rest, ice, compression, and elevation. So as you will see, whenever I saw that my victim was injured, I helped her to sit down, and then I elevated the foot that was injured, so elevation. Then I gave her an ice pack and I compressed it. So now we're going to talk about actually splinting the extremity. And since I didn't really have, I just had, household items, so I just used a pillow and I used that as a splint, and then I wrapped t-shirts around it because I didn't really have any bandages. And after that, I tested to make sure that it wasn't too tight or anything, and I felt for a pulse to make sure that, the blood was circulating properly. And then I helped her get up and carried her to the EMS. Are you okay? Are you okay? Sit down. Okay. My name is Miranda, and I'm a first aid provider. Is it okay if I take a look at your ankle?
Yes.
Okay. So what I'm going to do is I'm going to stabilize it. It hurts when I do that?
Yes.
Okay. So do it like that. Okay. I'm going to put my gloves on. So what were you doing to twist your ankle?
I was just walking.
Okay. Well, I'm gonna help you out, make it a little bit better. Okay. So first, what I'm gonna do is I'm going to apply ice to it. Okay. It's good.
Yeah.
Put it right here. And then I'm going to stabilize it with this pillow. I'm going to lift it up a little bit, let me know if I'm hurting you.
Okay.
Good. And then I'm going to wrap a few t-shirts around. Lift up a little bit. Now put it back down. Gonna do one more. Okay, now does that feel too tight?
No.
Okay. And I'm just gonna press your toes to make sure I can get some type of pressure and feel for a pulse. Okay. Is it feeling a little better? So I have brought my victim to the EMS so that she can get properly looked at. And now it's time to take off my gloves. So I'm gonna take them off, making sure that the inside does not touch me. I'm gonna fold them on the outside, and then I'm gonna dispose of them in a plastic bag, tie it up, and dispose of it so that no one gets contaminated. Thank you for watching.